All right, welcome back, guys. This is kind of part 3 on my dry needling therapy series, kind of highlighting that therapy we do here in the clinic. And on this video, I want to focus on how often do you do dry needling? Do you need to do it every single day? Do you need to do it 3 times a week, twice a week, just once? Or what kind of outcomes are we looking for? And how do we know if we're progressing with the dry needling? Generally, if you have really acute, tight muscles, I recommend doing dry needling twice a week to start. Right? We'll do it twice a week, generally in this clinic for generally about 2 weeks. So that's 3 to 4 dry needling sessions if it's something that you can tolerate. Generally, we're going to see a pretty solid reduction in pain symptoms throughout that first couple weeks with the dry needling, just because we're getting in there and we're just forcing the body to heal, right? You might get some soreness from it. That's totally expected and totally common, but you won't need to do dry needling essentially every time you come in forever, right? It's one of those therapies that we're really just attacking dysfunctional tissue, forcing the body to restore it and then return it to being functional tissue. Once it's functional again, you don't really need to needle it. Now, if you're a really high intensity athlete or a really active person, you might need some maintenance care, some dry needling every now and again, and especially if it's a therapy that works for you, it might be considered, you might want to consider just using it occasionally. If you've got training for a marathon or something, some dry needling in the calves is probably going to just be part of your maintenance routine. But it's not a therapy that you need to get 3 times a week forever to see results. Generally, a few sessions with it, you're going to get pretty good results. And another thing that we use in conjunction sometimes with dry needling is a stim unit like this here. We essentially have these what look like just little jumper cables basically, and we attach those to the needles themselves, and it just sends an electrical current between the 2 needles. If you've ever done e-stim with like the pads that you put on the back and it just makes the muscle kind of twitch and grab, this does the exact same thing. It just uses the needles as your contact points. So we'll utilize this sometimes for people that have really chronic muscle tension, really chronic muscle pain, or if we have done a couple sessions of dry needling and we haven't gotten the results we want, I'll throw this bad boy on there just to give it a little bit of extra juice and see if we can't change the result that we're getting.